Hello, it's Dr. Aditi again, and today we're talking about the anterior triangles of the neck, right? This is the spot on your neck that's sort of the crossroads of breathing, swallowing, speaking, and circulation. There's a lot going on in there. So I had done a video on posterior sort of muscles of the neck, but now we're going to talk about the anterior. And this is really nifty because it's sort of divided into triangles to make things a little easier. So we're going to go through each of these triangles so you can figure out what's located where, and that's really going to help you in anatomy class. So let's get cracking. So the nice thing about the anterior triangles of the neck is that they're sort of categorized and divided into these subdivisions. There are actually 4 of them, but there are 2 muscles you definitely need to know and understand before you sort of dive into these triangles. The first muscle is your digastric. Do you remember that muscle? This is the one, it has 2 bellies. It's sort of in this chin area. And basically, it's got an anterior and posterior portion, which is then connected by intermediate tendon. The anterior belly, this is going to be your the anterior belly of the digastric muscle. It originates in the mandible, in the fossa of the mandible, and it inserts into the tendon, which is close to the hyoid bone. And then we've got the posterior belly, and that actually starts with the mastoid process. It's actually the mastoid notch of the temporal bone, and then it also attaches to the tendon that is close to the hyoid. Okay. Function is basically depressing the mandible, basically opening your mouth, and elevating it when you're swallowing. Then we've got the omohyoid. Do you remember that one? It's more like a scarf. It also has 2 bellies, superior and inferior, which are also connected by an intermediate tendon. So the inferior one actually starts in the superior border of your scapula near the, what's it called? The suprascapular notch. And then it inserts into an intermediate tendon. And then the superior belly, that's actually going to start from that tendon, and it goes to the lower border body of the hyoid bone. Okay, and that depresses and stabilizes the hyoid bone, sort of keeps things together. Okay, just need to have those 2 basics down. If you don't remember those, go watch my other video on the neck muscles to highlight that. Okay, so now what are the 4 subdivisions? Well, the first one is the submental triangle. Okay, then we've got the submandibular, which is also called the digastric triangle. Then we've got the carotid triangle and the muscular. So those essentially, they all have very unique contents and boundaries, and we're going to sort of go through that next. Okay, the first one we're going to look at is the submandibular triangle. Now this triangle is wedged between the digastric muscle bellies and sort of in this spot right here, right? Now the floor, the way I remember the floor is using the mnemonic shield. This will tell you the contents of the triangle in the floor. So the S is for some submandibular gland. The H is for the hypoglossal nerve. I is for inferior belly of the omohyoid. L is for the lingual nerve, and D is for the digastric muscle. And then you can see the borders of the triangle. The inferior border goes towards the mandible, and then we've got the anterior belly of the digastric as the other border, and then the posterior belly of the digastric is going to be the bottom border or the base of the triangle. So when you're learning this, I would actually just, sort of use your finger and get some tactile prompts there, because that will help you remember. Okay, let's move on to the submental triangle. Oh, before I go there, the one thing I wanted to point out is this is a hot spot for swellings, because here is where the lymph glands are there and salivary glands are there. So you can have a lot of issues with that in this area, especially like if you go to dental school. I think that's an area they're definitely going to focus on. Okay, submental triangle. Now this is a tiny, tiny triangle, and it sits right under your chin. Again, you should be prompting. Kinesthetic learning is really important too. And if you are somebody who does well with kinesthetics, this would be what you should do. Cue yourself, prompt yourself. So submandibular and submental. So this tiny triangle sits right under your chin, and the boundaries basically are the anterior belly of the digastric. So right here we've got the anterior belly of the digastric, and then you've got the midline of the neck, and then the base is your hyoid bone down here, right? So what are the contents? Well, we've got the submental lymph nodes and the anterior jugular vein. So this is going to be really important, right? Again, think about swollen submental nodes. This is going to be your dental trauma. Like if you have infections after going to the dentist, this is where it's all sort of happening, right? Okay, moving on. All right, so now we've got the power hub triangle, which is the carotid. Now, this is home to the major vessels and nerves, and it has some major things that it houses there. So this is a triangle that you definitely need to know, and you definitely don't want to get injured because there's so much happening here. So again, trace it. If you want to go by your ear, that's a good place to start. And what you're doing is you're going down, and this is the sternohyoid and posterior belly of the digastric muscle, and then the base is your superior belly of the omohyoid muscle. Then you're going back up against the anterior border of the SCM, the sternocleidomastoid. So again, using that kinesthetic sense is really helpful. Okay, what are the contents? Well, there's a plethora of really VIP structures here. We've got the common carotid artery, external carotid artery, internal one also. Then we've got the jugular vein, the internal one, common facial vein, lingual, superior and mid-thyroid veins, and then a bunch of cranial nerves. So you do not want to injure this spot. That would not be a good scenario in any situation. Okay, then we've got the muscular. And just like the triangle, the name of the triangle infers, this triangle houses all of these muscles: sternohyoid, sternothyroid, and thyrohyoid. And these muscles help power the hyoid and the larynx during swallowing. And also tucked inside, we've got the thyroid gland, trachea, esophagus, right? So the very vital organs or portions that are important for breathing, metabolism, and digestion. So this is a very important triangle also. Well, they're all important, but in different ways, right? So when you're trying to kinesthetically learn this, the best way is to look for the border of, well, actually, I would start at the midline of your neck. That's one of the borders, right? And then you're going up to the hyoid bone. That's the apex of your triangle. And then if you come down, you're going to go down with the superior belly of the omohyoid and then the anterior border of the SCM. That is your triangle right there. So it's a little, I can't look at myself in the video because I can't do it otherwise. You have to definitely have kinesthetic sense feeling to trace it onto yourself. But if you do that, that will help you memorize it. So hope that helps. Right, and as usual, I always have a mind map for you on this topic today, and this is all about the anterior triangles. It has each of them labeled with the contents and the borders, but don't forget to use that kinesthetic sense to try to find that triangle on yourself, because that will help prompt you when you're taking tests or studying. Okay, so if you would like a copy of this, please do pop a comment and I will send it to you. Thank you all and see you next time. Bye.